So this section is about how to access dental care. NICE guidance states that care homes should make an appointment for the resident to see a dental practitioner if necessary. If possible, try to arrange for the resident to attend the same dentist that they saw before they moved into the care home. This maintains continuity of care and being seen by someone that knows them. This is important, especially for someone with dementia, but may not always be possible if they have mobility issues. In England, NHS dental charges apply for those over 18 years of age. Individuals aged 60 years old or above still pay these. In Scotland and Wales, dental checkups are free for older people. On admission, residents that need to apply for exemption or reduction of dental charges, they or the care manager on their behalf will need to complete a HC1 form or a HC1SC form, whichever is appropriate. The resident's exemption status needs to be checked before dental appointments, as it may change. For further information, please refer to the toolkit. Private dentists set their own fees for examination and treatment. If a home has an arrangement with a private dentist to provide services, patients' charges should be made known in advance. Some people may have insurance to cover the cost of dental treatment. The home should ask about this before any treatment starts. Community dental services or special care dental services are available to help people who are unable to use general dental services and who meet their criteria for receiving care. For urgent dental care, which is illness or injury that requires urgent attention but is not life-threatening, then care should be provided within 24 hours unless the condition worsens. An example may be when a resident needs to see a dentist due to pain, which is not helped by painkillers. Seek treatment at their own dentist first. If this isn't possible, ring 111 for advice and options. For emergency dental care, which is defined as life-threatening illnesses or accidents which require immediate intensive treatment, for example, uncontrollable bleeding following extractions, rapidly increasing swelling around the throat or eye, or dental trauma, seek help immediately in a hospital accident and emergency department. Information for the dental practice. Please make sure to provide the resident's personal details, including their NHS number, if they're exempt from paying dental charges, their full medical history, and a list of all medications. And an indication of the resident's need before the dental visit to ensure optimum use of clinical time and effective care is provided. Find out if there are any physical barriers at the practice before making an appointment, and tell the practice if the resident has any physical impairment or disability so that they can signpost to an alternative, more accessible practice if necessary. Ask the practice to tell you if there is a long NHS wait at that practice, and if there is, then to suggest an alternative. At the end of the appointment, remember to ask for information that will help to develop an effective mouth care plan. In summary, ask if the person has a dentist when the resident moves into the home. Find out about your local NHS dental services and make sure details of how to access a dentist are in the oral health policy. Try to find out about exemption status in advance of a dental appointment. And agree with the family and carers who will be responsible for organising an appointment and taking the individual to the dentist.